Hi, everybody. Dr. Jake here. I'm going to talk about purposeful movement, and this has a place in our everyday lives. When we're transitioning from one movement to the other, uh, we don't put a lot of thought into it. And if we have any weak links, they can be exposed, and that exposure can cause aggravation. Once, uh, once something's aggravated, it might linger, and that turns a good day into a bad day. So, I'm going to talk about a very simple transition of going from a seated position to a standing position. And so when we do this, we have to think about what's involved. So first off, the knee's a hinge joint. It goes back and forth. So anytime you put any rotation or angling, then you could expose a weak link. Also, the hips themselves is a very mobile joint, but that ball needs to be sitting right in that socket. And so, the better you're able to centralize that joint itself, the easier time it's going to be to actually put weight on it because there's a weight bearing bone or joint. And if it's not sitting right, then that could cause some pinching and possibly some aggravation, especially if there's already some arthritic changes going on. So the first step is priming that movement. And so you want to get the muscles starting activated, especially if you've been sitting for a long time, let's say a car ride or just out to lunch, whatever. Uh, Push your heels into the ground. And you can do that by 1 foot at a time, both feet at a time. It doesn't matter. But basically, what you want to feel is you want to feel your quads, your thigh muscles contract, all the muscles around the hip contract. And if you push the heels into the ground, that's going to feel like you're almost rocking back and forth with your hips. Now, that's going to bring good blood flow to the area. It's going to make sure all the muscles are awake and ready to fire. And then once you feel comfortable, you're going to start standing up. Now, when you do that, you're going to use your hands to push yourself up. And you need to have your thigh, your knee, your shin, your foot all in the same plane and stand right up. You don't want to see any of this. What does that do? That angles that knee, and now you're loading it. And so that could cause some pinching and some aggravation. Secondly, once you're up, the most common mistake people have is they get up and then they twist if they're turning 180 or not. Okay, so that's going to put tension and torque both in the knee and the hip, and that could be a major aggravator. So instead, when you stand up, move your body and your feet and then move. Secondly, before you stand up, you could actually turn and then stand and go. This will take less pressure off the knee, less pressure off the hip, less torque, and create a position of stability. So that way you could transition fluidly. I hope this helps. I know this is an exercise that I give to a lot of my patients, and it sounds so simple, but just remember purposeful movement. This will take a good day and continue to make it a good day. Let's eliminate some of the bad days. Guys, I love you. Talk to you soon. Bye.